Alright guys, so today we're going to take a look at pink eye, also known as conjunctivitis, which basically means inflammation of the conjunctiva, the outer membrane that protects the eye. This is an extremely common condition that we see every day in the pharmacy, mainly because it happens for many different reasons. The three main types of conjunctivitis are bacterial, viral, and allergic. So bacterial and viral, they're infectious, they're caused by an infection, while allergic is caused by an allergen and not contagious. These different types of pink eye have a lot of similarities, but there are ways that we can differentiate them based on their symptoms. The first one we're going to take a look at is bacterial. It's not as common as viral conjunctivitis, and it usually occurs mostly in children. We don't see it as frequently in adults. The main symptoms are itchiness, yellow discharge that forms a crust, causing sticky eyelids when you wake up. Usually starts off in one eye, but easily spreads to the other eye because of how contagious it is. So for those of you who wear contact lenses, we're going to try to wear glasses instead during the infection and replace the contact lenses to avoid reinfection. It's actually not necessary to treat this condition. It goes away on its own. However, antibiotic eye drops can shorten the duration of the infection according to studies. So it is recommended to get treated just because it can speed up your recovery. Other ways you can soothe your symptoms is with water compresses that you can use for 5 to 10 minutes every 4 to 6 hours or so. Here we have pink eye that is caused by a virus, which is actually the most common type. The symptoms are very similar to bacterial. They include pink, watery, itchy eyes. The main difference is we might not see yellow discharge or crusts with this type of pink eye, although it's still a possible symptom. It can be hard sometimes to differentiate between bacterial and viral pink eye, but a sign that we're dealing with a viral infection is when it happens at the same time as a cold, because it's usually the same virus that causes a cold that causes the pink eye. Also, it's important to know that these infectious conjunctivitis, viral or bacterial, are very contagious, so we try to avoid touching the eyes and eyelids when infected. So in summary, if we have a strong suspicion that it's bacterial, then yes, we would treat with antibiotic eye drops. But if we're leaning more towards a viral infection, then we would focus solely on symptom relief with artificial tears and water compresses. There is no available treatment for viral conjunctivitis. It goes away on its own. Finally, we have pink eye that's caused by an allergen, such as to dust mites, pollen, mold, etc. The most common type is seasonal. It usually starts in the spring season when trees release their pollen in the air, but it can also be caused by an allergen that is present throughout the year, such as to dust mites. The symptoms we see here are very similar to viral, although it's not an infection and it's not contagious. The main difference is that usually both eyes are affected from the start, whereas for infectious, it usually starts off in one eye and might spread to the other through direct or indirect contact with the affected eye. So how do we go about and treat allergic conjunctivitis? Our first choice is usually anti-allergy eye drops, such as cromolyn, a mast cell stabilizer, or Pataday, an antihistamine for local relief. Oral antihistamines such as Rictin or Claritin can also help relieve these symptoms and are usually our go-to in the presence of other allergy symptoms such as a runny nose. Another way we can soothe their symptoms is by using artificial tears, which will lubricate the conjunctiva and create a protective film on the eye. This will also serve to dilute the allergen, which will reduce its contact with the eye. So as we were saying, guys, it's not necessary to treat conjunctivitis unless we see symptoms that would require a consultation. These are what we call red flags. If you happen to have any of these three symptoms, sensitivity to light, direct pain in the eye, or you notice your vision isn't as sharp, that's a sign to see a doctor for an evaluation. I want to add also that being less than 6 months old is another reason to see a doctor because a child of that age is vulnerable to more serious complications. For example, usually when pink eye occurs in the first month of age, the bacteria in question comes from the vaginal canal from childbirth, as is the case for chlamydial conjunctivitis, and polysporin would not be indicated in that case. We would require a different antibiotic. So in summary, guys, the vast majority of cases of pink eye will resolve on their own within 5 to 7 days without any treatment. If you don't have any of the red flags, it's not necessary to see a doctor. If you do have red flags, it's important to consult as soon as possible.